Hi, today we'll be discussing the main difference between malaria and dengue fever. Malaria is caused by an infection with Plasmodium parasite, while dengue fever is a disease caused by infection with dengue virus. Types of mosquitoes that carry this disease are also different. Malaria is caused by Anopheles mosquito, and whereas for dengue it's Aedes aegypti and Aedes albopictus. Both these type of mosquitoes not only found in dirty water but also found in clean water puddles. Now coming to symptoms of malaria. This will be appear after 10 days to 4 weeks. That means a month after exposure to parasitic infection. Main symptoms include high fever, headaches, chills, muscle aches, nausea, vomiting, diarrhea. And also in some cases, chest pain, breathing problems, coughing, and other symptoms are also seen. If malaria is not treated immediately, we can see anemia and jaundice in some cases. Now comes symptoms of dengue, which are similar to malaria, which will appear in 5 to 7 days. Most importantly, we see muscle pain, joint pain, abdominal pain, headache, something like that. And in some cases, red spots will appear due to bleeding gums or nosebleeds, which indicates blood vessels have leaked the blood plasma, resulting in signs of bleeding in skin and other organs. Now, how can we recognize whether we are affected with malaria or dengue? For malaria, tests are PCR test, which is polymerase chain reaction test, which allows sensitive and specific detection of Plasmodium species DNA from peripheral blood. And blood smear test is also performed where it is simple to look for parasites under microscope. The other test is rapid diagnostic test RDT. Check for certain proteins that came from malarial parasites. And also most commonly ELISA test is performed where it indicates enzyme linked immunosorbent assay, which is used to detect antibodies in our blood. Now coming to dengue test. Here also PCR test is performed along with some complete blood count test will be performed, and also some antigen NSI, immunoglobulin G and immunoglobulin M tests were performed, where altogether these will detect non-structural protein component of dengue virus and the antibodies produced by the body in response to the infection. Now coming to the drugs we use for these two type of fevers. Firstly, for dengue, the most important painkiller or to relieve pains is used acetaminophen, but not ibuprofen or no diclofenac or no other NSAIDs, because these drugs have the effect of inhibiting platelet aggregation, causing blood loss. The main drug is caripryl, that is caripyl, which is used when platelets count decreases. This caripyl tablet increases platelet count in patients suffering from dengue, which contains carica papaya leaf extracts. Now coming to malarial drugs. Mainly artemisinin based combination therapies are used. most commonly seen malarial drugs are atovaquone, chloroquine, doxycycline, mefloquine, primaquine. All quinine tablets in common we can remember as malarial drugs.